Isn't a diagnosis just another label? Why do I even need to have one? Let's talk about that today on Mental Health Minute with Kim. When you're not feeling well and you go to a doctor to find out what's going on, they may run some tests or do some kind of assessments, and you end up with a diagnosis. Now, a diagnosis is basically there to inform your treatment plan because they want to make sure that you're getting the right treatment for what's wrong with you. And the same goes for mental disorders. Therapists like myself have been trained to diagnose mental disorders, but we don't just do it willy-nilly. We use this, the DSM-5, and it's basically the Bible of mental disorders. But it's not just like going down a checklist and marking off some symptoms. We have to see what diagnosis best fits your symptoms. And to do that, that means that we have to be familiar with all different kinds of mental disorders because we have to rule out other mental disorders that may have the same or similar symptoms that you're experiencing. And a diagnosis is not to label you. It's, like I said, to get you the best treatment for what you have. We wouldn't want to treat you for schizophrenia if you have depression. That would not be effective at all, and it might mess you up. I have some clients who have dissociative identity disorder, formerly known as multiple personality disorder. And that one is so often misdiagnosed as borderline personality disorder, factitious disorder, somatic disorder, and some kind of psychotic disorder like schizophrenia. And all of the people that I treat who have dissociative identity disorder have been incorrectly diagnosed as having schizophrenia in the past, and they were put on antipsychotic medication, and it really messed them up. So you can see why having a diagnosis is an important part of getting treatment for whatever's wrong with you. I'll see you next week.